With hospitals across the country now the front lines in the battle against COVID-19, fear of catching coronavirus is keeping other patients away. And now, more than ever, they're turning to healthcare consultations of a different type.
It's Dr. McGee. How are you doing?
It's called telemedicine, virtual visits on computers, even smartphones. It's not new, but the advancement and availability of technology has pushed it into overdrive.
We've done over 5,000 visits over the past month.
That's up from just 20 a month before COVID hit, an astonishing increase for Dr. Michael Main and his colleagues at St. Luke's Mid-America Heart Institute in Kansas City.
And what the COVID-19 pandemic has forced us to do is to innovate.
Their priority? Protecting both their staff and vulnerable patients like 89-year-old stroke survivor Carl Hines.
Having any problems with chest pain?
No.
And at a time when medical resources are stretched thin and so many of us are staying home, these routine virtual visits are a lifeline for heart patient Gail Collette.
Have you had any episodes of those palpitations?
Well, actually, I did.
Checking in about medications, symptoms, and solutions.
I felt it was very beneficial and very reassuring.
Reassuring for doctors, too, like New York City primary care physician Arthi Reddy. Staying connected with her patients from a desk in her boy's bedroom. She says figuring out which in-person visits can and cannot wait during the COVID crisis depends on each patient.
Right now, we are holding off on any screening, colonoscopies, mammograms, even yearly blood work. Unless the patient's presenting with something concerning, we're not doing those.
But what can't wait? Visit your doctor or the ER if you have shortness of breath or signs of a heart attack or stroke, a broken bone or large cut that won't stop bleeding, and problems with a pregnancy. And even though most dentist offices are closed for routine procedures, there are exceptions.
Anything with pain or anything that decreases the quality of life, for the patient. And so obviously infections, abscesses, severe decay, any broken teeth.
Handled with care and taking extreme precautions.
We're not just protecting the patients and the community, we're also protecting ourselves.
There too, our thanks to Dr. Torres for that report.